Beautiful. Hi, hello, folks. Out in Instagram and other places that we are going to be. We are here to have a conversation about monkeypox for a lot of different reasons. That it is a new disease that is ravaging across not only the country but the world, and we also want to make sure that folks here at UC Davis are able to stay safe, know what information is out there, what resources are available. So I have two lovely folks here that are gonna talk more with me and have a conversation. So just so you know, we wanted to make sure that we're safe and we wanted to make sure that our community is safe. And so all of us are wearing masks for that reason. But we'll get started with some brief introduction. So my name is Tristan or TK Morton. My pronouns are Z, Zir, and Zirs, and I'm the director of the LGBTQIA Research Center here at UC Davis. I'm going to pass it off to you, Blake.
Yes, hello. Thanks for having us today. So my name is Blake Flaugher. I use he, him pronouns, and I am the Sexual Health Promotion Specialist at Health Education and Promotion within Student Health and Counseling Services.
Yes, thank you so much for having us. My name is Cindy Shorzman. I use she, her pronouns. I'm a family practice physician, and I'm the medical director at Student Health and Counseling Services here at UC Davis.
Thank y'all both so much for being here and sharing not only this conversation with the UC Davis community, but also to queer and trans folks that might be feeling very uneasy, feeling very wary about coming to campus in a couple weeks, and making sure that our community knows about the resources and what is monkeypox and how to be able to support and help prevent it from spreading.
Yeah.
So I think the biggest thing to try to ask is what is monkeypox, as well as how is it currently being transmitted?
Yeah, that's a great question. So monkeypox has actually been around for quite some time, but this particular strain is spreading in a way that we really haven't seen before. So it's a viral infection, and the most common way that it's spread is through intimate skin-to-skin contact, although it can be spread through blankets and sheets and other fabrics that person has been in contact with. So it can be spread even if you're not in direct contact with that person. It can be spread if you're in contact with sheets that someone else has been in contact with. And it can also be spread through respiratory droplets, although we're learning more about that. What we don't know so far, we don't know if it's spread asymptomatically. There are some small studies that suggest that someone can spread it even without symptoms, but we're still learning more about that.
Thank you so much. Yeah, I know that a lot of folks have been very confused about oh, is it only sexually transmitted, which we know now that is not the case, and knowing that it can be transmitted via folks' clothing, and still, of course, we know that since this is a new developing strain, that there's going to be a lot more testing that is happening to figure out the exact root and causes of how it's spread, and how we are able to help support the what is the word I'm thinking of, the slower progress of transmission. Blake, for you, how is this virus being prevented? How are we able to keep ourselves and our community safe?
Yeah, great question. So as Dr. Shorzman said, the most common way that it's being transmitted right now is through intimate skin-to-skin contact. So specifically, mainly during sexual activity is what we're seeing so far. And, using basic principles that we already know from COVID, like wash your hands, stay home if you're sick, be aware of your body, especially, seek health care, and let any sexual partners know if you have any new rashes, any kind of flu-like symptoms. Just really be aware of your body and communicate with your partners, your potential partners, so that you can both be on the same page.
Thank you so much for that, and to making sure that just because you might be having intimate contact with folks does not mean that y'all folks should not be continuing to have these conversations to make sure that they're safe. It's not a bad thing to talk to your sexual partners about how to keep each other safe,
Yeah.
Whether that is one-on-one, multiple people, because not only are we all should be thinking cognitively about our health, we should also be thinking the same of folks that we are around and how we can make sure that we're all being protected in the best ways that we can and being informed.
Yes, absolutely. I'd like to add to that, actually.
Yeah.
So, condoms, we have to talk about condoms. So, condoms, we don't know if monkeypox, if the monkeypox virus is spread via semen, vaginal fluids, rectal mucus, urine. We don't know that yet. Scientists are still looking into that. But best practice, still use condoms or another barrier like dental dams. You can get all these for free at the Love Lab. It won't cover all of the skin if there's a lesion, for example, but it'll still offer maybe some protection, especially while we don't know exactly all the details about how it's transmitted.
Yeah, and just so folks know, like Blake said, the Love Lab also has a lot of these safer sex items as well as several other places across campus as well, which is pretty easy to get, and it's what, for free. Yeah. So I wanted to ask both of you: is there treatment available if folks do happen to get monkeypox? And what does treatment look like for folks?
Well, that's a great question. So the first thing to know is if there is a known exposure. So if you find out that you were with someone who's diagnosed with monkeypox, it is very important to have that discussion with your provider, because if you get the vaccine, if you haven't gotten it yet, if you get it right after that exposure, you're actually much more likely to either not get symptoms at all or to get much less severe symptoms. It's called post-exposure prophylaxis. So even if you have had that exposure, the vaccine can still really help, especially early on. But once someone has the symptoms, and which go from typically flu-like symptoms, so muscle aches, fevers, chills, and then a few days later they may develop a rash. Although the rash can sometimes only appear in places that people aren't quite sure that that's the rash of monkeypox, so sometimes it can get a little tricky to diagnose, or some people can unfortunately have sores all over, fluid-filled blisters. But once someone has those symptoms and it's diagnosed as monkeypox, or likely monkeypox based on their known exposure and then symptoms, there are medications that can be taken that can really reduce the severity of those symptoms. Not everyone who gets monkeypox necessarily needs to take medication, but for people who are really having a hard time or are at risk for developing more severe disease, there are absolutely medications that can be taken. And as of yesterday, at Student Health and Counseling Services, we do have that medication available by prescription in our institution for those students who are diagnosed and need that extra medical.
Oh wow, that's so great! As of yesterday, oh, we love this. Yeah, I feel like a lot of folks in the campus community will feel a little more at ease knowing that if by chance they were exposed, that there's a resource that is easy to access for them, like that's on campus. Because I know for some folks it's been a little bit difficult trying to figure out who do they need to go to their primary care physician as a student, who they need to go to, is it available on campus? So I know that I feel like for some folks they'll be like, oh, it'll be a little brief sigh of like relief of like, okay, like if something happened, there is something on campus that it can be worked out if folks have been exposed, which I think is really good.
Absolutely. We don't have the vaccine yet. We're
Yes.
working on getting that soon, but even if someone has a known exposure and comes into us, we can make sure and connect them to the vaccine either that day or the very next day.
Yeah, that's so good to know. And that actually leads into my next question is about vaccines. How, since right now on campus, like you shared, like you don't have vaccines yet, but if students who were exposed or might meet certain criteria, how would they be able to access the vaccine?
So right now, today, if someone feels that they look at those CDC guidelines, they look at those public health guidelines, and they raise their hand and say, yes, I feel like I'm at higher risk and I need to get this vaccine. Right now, today, our resources are in Sacramento County, so we coordinate closely with them. But we anticipate later in September that we'll be getting starting to get vaccine doses here in Yolo County, including at Student Health Center. The rollout unfortunately will be slow at first because there's been such a nationwide shortage.
Mhm.
We're actually using the smallpox vaccine, assuming that it's going to work well. And so far, the early studies have shown that it is working well against monkeypox. So that vaccine is being rolled out, and we anticipate having it soon. But really, if someone is worried today, if they have any questions about monkeypox, we want to hear from students
Yes.
because we can connect them with those resources. We can make sure they know how to get on that list in Sac County or how to get on our waiting list as it's being developed. We want to connect them with those resources. So just answer those questions. We don't want anyone out there worried and not knowing where to turn. We can help them find those answers.
Yeah, and thank you so much for that. I know for me, like that, like gives even me a lot of reassurance because we want to make sure, like Cindy shared, we want to make sure that all of the campus is aware of these resources, and we don't want folks to be struggling alone. And I feel like that's so important, especially with diseases that like we don't know about and they haven't been studied, especially with us going through this pandemic currently. It's too much. I feel like it's a lot. So Blake, I think a big thing that in a big narrative that we have been seeing over the last like 2 months, I would say, is that a lot of queer men and trans people, folks that are doing sex work, are the main communities being affected by monkeypox right now. We know that it is not. And what I want to reiterate, it is not it doesn't discriminate on anyone. So anyone can get it, but at this moment, it is mainly been affecting queer men and trans people. And so I think like what we're trying to figure out is like there's the big question of why, which we don't necessarily know why, but I feel like speaking from the perspective of how we can make sure that this isn't a continued stigmatizing factor on gay men and trans folks within the LGBTQ community to make sure that everyone knows that this is a public health issue and that queer issues are a part of public health.
Yeah.
So yeah.
Yeah, totally. It's a lot to unpack.
It's a lot.
No, that's such a great question. I'm so glad that you asked. I am gay. I'm a gay cisgender man. I'm very passionate about this myself. I have friends who, have been clamoring for the vaccine. And so it's been a very frustrating summer for our community, as we know. People have waited hours in lines for vaccines, sometimes to be told that they can't get them. People have been in tremendous amounts of pain and unable to get treatment or TPOX, as Dr. Shorzman was saying earlier. This virus has been used to stigmatize and incite violence against our community. So, yeah, like you said, anyone can get MPX. Not everyone is getting MPX right now. So we really need to focus on the communities most affected. And right now, studies are showing it is 98.5%, like you said, queer, cisgender men and trans people and their sexual networks. So with that said, lots of reasons. I think sexual networks of queer, cis men and trans people have been studied by public health officials and researchers and practitioners for a very long time. And what we know is just very, very small networks, small communities. If you put an infectious disease in a small community, it's going to spread a lot quicker.
Mm-hmm.
And so just that sheer reason alone is why it's so easy to get so many infections in such a short period of time. And so when we talk about that, we also have to talk about heterosexism and cissexism and, looking at how social structures and the medical system and just public health system in general prevent access to information, vaccination, testing, treatment for queer and trans people, and issues that make accessing those things a lot harder. So, and it's particularly impacting queer and trans people of color. And so Yeah, lots of reasons, mostly due to social determinants of health. So it's really that simple.
Yeah, and two, I feel like a lot of queer and trans folks are like really wanting to get the vaccine and like are still having like systemic issues. There have been folks speaking out, specifically trans women of color speaking out who were trying to get vaccines in New York, but they were turned away at the door, right? And how folks that even have access to the vaccine are still potentially getting discriminated because of X, Y, and Z factor, as well as what that looks like for folks who are sex workers too, which sex work is work, and making sure that folks who are doing sex work, whether that is their main profession or out of survival, also are included in these conversations because a lot of them are queer and trans people. And I feel like it's hitting, like you said, it's hitting our community really hard. Like as a trans person, like that's also a really big factor in knowing that I have friends and folks in my community that haven't been able to get the vaccine because they either don't meet the criteria or it's not available where they live. And I think it's something that is really important in that, like, yes, it is affecting queer men and trans people and sex workers specifically right now, and that anyone can get it, and we can't forget who are truly being the most affected at this time. So
Yeah.
recognizing that, like, yes, like this is still new, it's still growing information, and that this is a very, very big queer and trans issue that cannot be overlooked and cannot be stigmatized, because that can have so many negative effects of folks not wanting to get tested, folks making generalized assumptions without doing your research, do your research on reputable sites, peer-reviewed sources, all that good stuff, and making sure that their communities are safe. Yeah. So
Yeah.
it's a
Can
lot.
I
Yeah.
add to that?
Yeah.
Okay, cool. So, yes, absolutely. Snaps to everything you just said. I think there's also been a lot of comparison to monkeypox and HIV.
Mm-hmm.
And, there are a lot of similarities in terms of maybe who is being most impacted right now. And sure, the most common route for both is sexual activity. But there are major like historical, social, political contexts, right? And so a lot of folks are comparing the early days of AIDS, right?
Mhm.
Specifically to monkeypox.
Mhm.
I think it's also important to remember that, oh gosh, totally lost my train of thought. What was I going to say? Oh, it is very ignorant and it's not science-based to assume that just like HIV, just like people were doing with HIV, to assume that the monkeypox virus is going to only affect queer and trans people. Yeah. So like you've said a million times already, anyone can get it. It's really affecting our community right now, and there are people outside of the queer and trans community who've gotten it, and so that goes back to public health efforts. Like, how do we really make sure that we're controlling the spread in the communities where it is, because it will get out.
Yeah.
It will, and it has already, but it's just important to remember that. Viruses don't have eyes, right? So,
Yeah. And that's also why we're here, because
Yes.
we want to make sure that we are being able to share the most up-to-date and accurate information as we can, as well as to make sure that, like, not only the students and the community of Davis are safe, but also us too.
Yes.
Like, we're also included in this. Like, we
Mhm.
came together because we really care about this, and we want to make sure that we are sharing our voices to be like, hey, like, this is what we know. We want to be able to get this information out to as many folks as we can, right? So within that, what are we doing to support not just queer and trans folks that are that might be experiencing monkeypox, that are concerned about it, but in general, like, what does support look like?
Yeah. So I'll let you go first on that.
Sure.
Yeah.
So as far as around the issue of monkeypox, we're making sure that we're getting the right messages out there. We're making sure that people know the facts. So we've updated our own web pages, both in terms of the medical information that we put up in simple easy, plain language, but also important links to reputable, as you said, evidence-based sources. We're also have nurses that are absolutely ready. We have special intake forms and boxes, and we have nurses that are ready and willing and just waiting for students to reach out to them so we can answer those questions so that people aren't out there worried. We have telehealth appointments, so if someone wants to engage with a provider but is worried that they might have something or not, or for whatever reason don't want to come in or worried that they might spread something, they can have a phone visit or they can have a video visit with a provider. And we also, of course, love to see anybody in person for all of our services that we can help with. So we're really trying to help in a variety of ways, including this, because we care so much about the students. It's entirely why we're here.
Yeah.
And we want to support our community. So we want to make sure in as many ways as possible we can get out and reach students and answer those questions so that no one's afraid of.
Yeah, great answer. What a great, okay. So,
What a great team!
I know, I'm like, so, and as for me, so, you know, like I said, I kind of oversee the Love Lab, not all the sexual health initiatives, but on the health education, health promotion side. So, you know, students are coming back, y'all are coming back soon. And so we're definitely going to incorporate some training for our sexual well-being student coordinators and volunteers to go out and do some programming about MPOX and just get that basic prevention and just information out there and link students to resources. Also our Instagram, UCD Love Lab. We've made a couple of posts, we've put some stories up. So we're just gonna continue trying to really reduce stigma and link students to resources.
Yeah, and we are supporting all of the work that the Student Health Center and the Love Lab are doing. So look out for more things on our Instagram about that, as well as, again, if y'all have any any questions about monkeypox, like the fears, the anxieties that you might have if you're coming to campus or you might already be here, please don't hesitate to reach out to any of us. All of the Student Health Center and the Love Lab's information will be added to this video after this live afterwards. So please know that we are here to support you. We are here to make sure that we are keeping all of us safe, and we want to make sure that y'all are aware of this information. So thank y'all so much for being here
Thank you.
and having this conversation with me and sharing with our community. So thank y'all so much, and y'all have a good time. Bye.
Bye.